Hello, hope everybody's having a good weekend. I wanted to post a quick video to review some of the protocols that were submitted for assignment 2, highlighting some of the things that were really good and highlighting some things that were problematic. So I selected a few different protocols from each of you. They are completely anonymous, so your name's not shown, and this is really meant to be constructive. It's not meant to point out any particular limitation of anybody's performance. It's simply to provide all of you with further guidance of how to develop these protocols. So before getting into it, I want to highlight a couple things about the actual assignment. So the assignment said that specifically the task that you're going to be teaching the client is a task analysis or teeth brushing. So it says each student will develop and draft a behavioral protocol for a chaining procedure. So that means you have to use a chaining procedure. Each protocol will include a task analysis for the specific task to be taught, as well as instructions for teaching the task. And then you have to have a mastery criterion for each step and so forth. So the task is teeth brushing. So given all of that, you are required to develop a task analysis on teeth brushing. That is, breaking the complex behavioral chain of teeth brushing into its component parts. And you could do that to a greater or lesser extent. They could be very complex or very simple, depending on the individual. And you don't have any of that contextual information. So therefore, I didn't really grade too harshly on the task analysis, but you clearly needed to have one, and some folks did not include one. It specifies that you, after the task analysis, you are going to use a forward chaining procedure to teach teeth brushing. So forward chaining really sort of focuses on the sequence with which you will teach the steps in a task analysis. It doesn't necessarily provide the procedures for the actual teaching. And when we talked about forward chaining and backward chaining and total task presentation, we had mentioned that during the teaching of a particular step in the task analysis, you may use various prompting approaches. So most to least prompting, least to most, just specific hand-over-hand guidance, modeling, anything of that nature. But you did have to choose one or have something that was consistently described throughout the procedure. So I gave you some contextual information on where the sessions will take place, and I indicate that the target behaviors will either be correct response or incorrect response, or independent versus prompted. Now, again, this was an area I didn't grade too harshly on, but I'm simply giving you options to choose from and not really recommending any of these per se. It depends on what you're teaching and what type of measure you would like to obtain during your teaching. So many of you will see on your papers, I should say this first. Most of you used correct response. And that is not wrong, but in the context of teaching teeth brushing, or let me rephrase that, many of you put that the goal was to teach independent teeth brushing. So if that is the goal, then it's probably more direct of a measure to record independent versus prompted responses. And I'll kind of highlight that as I go through some examples. Okay, so you need to indicate how each step is taught and a variety of other things. So those were the instructions. I also included a tip sheet, and I'm not sure how many people actually used this. It seemed pretty clear that some of you did not look at this, and I think it could have been helpful. So let me just highlight some things. Once again, I kind of indicate the target behaviors, and I have correct response in here, independently completing. So again, that's not wrong, but maybe it's better just to say independent versus prompting. Okay, so that's more of a tip for future protocols. The one thing, again, that folks still struggle with, and I realize this is only the second protocol we've written in the class, is that your data collection needs to match your target behaviors. So for example, if you chose to define a correct response, excuse me, then your data collection is probably going to be the percentage of correct responses. Some of you change things up, and again, I don't have the papers in front of me, but some of you said the target behavior was correct responses, but data collection was on occurrence versus non-occurrence. And again, that's sort of okay, because my assumption was you mean the occurrence of a correct response versus not occurring. But stay consistent. Data collection could be correct response versus incorrect response. Or I think some people had a lack of correspondence across the purpose, target behavior, and data collection. So for example, I think one person put the purpose was to increase independent teeth brushing with, like 100% accuracy. Now, accuracy is a whole different thing, right? The accuracy with which we complete each step of the task analysis is a different measure than independently completing, right? I can independently complete something, but it may not be accurate. So you want to just keep these things consistent. If you're interested in the accuracy of a response, then measure the accuracy of a response and define a target behavior, accurate responding. Okay, so hopefully that's clear, at least for the next protocol, protocol 3. So make sure that there is correspondence between the way you phrase things in the purpose, the target behavior, and your measures, and of course, data collection. And once again, I just encourage you, what is the target behavior? This is another area where I think people struggled because they saw the target behavior as teeth brushing. That is a complex chain of behaviors that make up teeth brushing. So therefore, the target needed to be something that was flexible enough to be relevant across each particular step of the task analysis. And again, I'll highlight that as we go through it, or through some of the examples. I don't think I have anything really to say about intervention titles. A lot of you said positive reinforcement, and that's okay. I don't think many people said that forward chaining was an intervention, and that is the intervention. Task analysis is not necessarily an intervention. It's okay if you have it in the intervention, but it's more of a set of steps just outlined. So most of you, I think a good portion of you, seem to simply copy and paste what I did, which is okay. That that resource was there for you, but these were really written in a way that were to inform you, so to provide some guidance. So you didn't have to say teaching begins on step 1. I mean, that's okay. Once again, when we get to some examples, I will highlight that. Okay, so the other thing I say here, and this is something that I described in the lecture on chaining procedures, when we are teaching using forward chaining, for example, basically what happens is we teach step 1. So if teeth brushing consists of 10 steps, it means that when our first session rolls around, we teach step 1. So let's just say it's pick up the toothbrush. So we provide the SD, hey, time to brush teeth, and we probably read the first step. Pick up the toothbrush. If the individual doesn't respond, we teach, and we're probably going to use a prompting procedure. Once that step is complete, we can't teach anymore. I mean, you could run through a couple repetitions for sure, but something like teeth brushing, we typically teach over the course of a day, where each time it's appropriate for the individual to brush their teeth, we run through these steps. So once step 1 has been taught, and it may not have been taught to mastery, but once we teach and step 1 is complete, then we complete the rest of the steps for the individual. So we follow that procedure until the individual meets mastery on step 1. So that could take a day, 3 sessions of teeth brushing, or it could take a couple days. Then, once they master step 1, we move on in sequence to teach steps 2, 3, and 4. But once again, the way that looks in practice is simply step 1 has been acquired. So, Johnny, time to brush your teeth, pick up the toothbrush. He probably does that if that step has been acquired. Step 2, let's just say, for sake of simplicity, it's put on toothpaste. If he can't do that, then we teach that step. And then once we've taught that step, we complete the rest of the task analysis, steps in the task analysis for him. Maybe using hand-over-hand guidance or just simply, holding the toothbrush yourself. So the thing you have to keep in mind is we are teaching a step, then we complete the chain of behavior, or the remaining steps in the task analysis. Once the first step has been acquired, we move to teaching the next step, and so forth. Okay, I realize it's probably a little bit difficult to follow a verbal description of that. So once again, I'll try to highlight it as I go through some examples. Okay, so here's one example. Now, once again, your names have been removed. If just because I selected your article or your summary rather does not mean it was the best. There are good things in everybody's protocol, so I'm simply highlighting things that looked good or things that were appropriate, as well as things that need work. So all of you, I think, could benefit from the feedback that's being provided here. So once again, I think many of you, I'm not going to go through all of this, but all of you kind of struggle with this target behavior. Now, again, I'm not going to pick on the correct response versus independent response, but I will reiterate that if we're interested in the responses being independent, which a lot of you put for a goal, then I think we should just call it independent response versus prompted response, right? If we're teaching appropriately, there's probably not going to be a lot of room for an incorrect response. And that said, I guess this step could be implemented or emitted rather incorrectly, but we could catch it and correct it. Okay, so correct response isn't wrong, but we should try to make sure that we are as direct as possible. So with this, all of you again are still keeping, because the template has behavior 1 and so forth. You don't have to keep those things in that protocol template that I sent out. Just list the behavior, so that this behavior 1 is where you should be putting the behavior, correct response. So the target behavior here is correct response. Now this definition is problematic, right? So it's not really describing what a correct response is, nor does this behavior 1. So we need to be careful. If I were to off the top of my head define a correct response, or let's just say an independent response, we have to reference a task analysis, and I guess this student did that, but it would read something like child completes targeted step on the task analysis without prompting, right? So that would be an independent response. And now the thing about that definition is we have to reference the task analysis to figure out what the step should look like, what an independent completion would look like. The one thing about this is the student's protocol is the task analysis was fantastic. The formatting was not great. So what I'd recommend for something like this, and formatting is an individualized thing. I don't take points off particularly for formatting, but something like this probably would have been better. right? So we're numbering the steps. That's a great format for a task analysis, and they're very easy to read. So once again, I just want to highlight on this one, this was a great task analysis. So you have the steps and then what happens in each step. Pick up toothbrush. Child picks up toothbrush with dominant hand. Rinse off toothbrush, right? So all the steps are listed. And again, each of us probably have a different way of brushing our teeth and so forth. So I didn't really take points off for that, but this one was the most complete description of each step. And I thought that was a really good feature. Okay, the incorrect response thing, I think it's worth it to have, or if it's prompted response, I think it is worth it to have if the child does not perform the step in a certain amount of time, that's appropriate. Engages in another response other than the target behavior. Now, I don't think we're so concerned with this type of thing in this sort of teaching program, right? Of course, we could say pick up the toothbrush and the child can turn on the water, and that would be incorrect. What we're interested in is teaching the actual skill of teeth brushing and all the steps involved. So if I say pick up the toothbrush and the child does something else, I'm going to prompt or use some teaching to bring about the right response. So it would simply be a prompted response. Okay, so I think, again, if I were to do this type of protocol, I would stick with independent responding versus prompted responding. And, the definitions you have are pretty good here. Okay. Let's see. Anything else I could point out here? The interventions are appropriate. This individual included a baseline, which was a nice inclusion. I think, this was also good. So this individual used forward chaining, so they specified the approach, but also how the steps were going to be taught. A lot of people left this out. They may have said, they're going to prompt, but there are specific prompting procedures that we discussed. You should be using those terms. Least to most was one of them, and this is a great strategy for this type of a task. So deliver the verbal prompt, pick up toothbrush. If it occurs, positive reinforcement. If it does not respond, provide an imitative prompt by picking up the toothbrush, and so forth. So we would call that, in the context of least to most, a gesture prompt. So you're going verbal. Imitative is okay, but gesture would be technically correct, to physical. So that is a nice description of how we actually teach that step. The other thing that was great, okay, I'm sorry. So the individual did leave out the one critical piece so we're starting on step one. We're going to use this least to most to teach it. Then after we've taught step one, the therapist completes the rest of the steps. That's sort of the first big chunk of our procedures. The next thing we could do to abbreviate the remaining procedures is indicate something to the effect of, once step one has met mastery criterion, and we have to spell that out, move on to teaching step two, following the same procedures, right? So essentially, that second clause, if you will, indicates that once step one's complete, we kind of go back here but plug in step two. So that would specify that the therapist delivers the SD for the first step first, and that should be mastered. So the individual should do it independently or correctly, whatever you choose. Then they move on to step two, which they presumably have not acquired. So we teach on step two. Once we've taught step two, not to mastery, we just went through a teaching trial, so to speak, we complete the rest of the steps. Once step 2 has been mastered, we repeat the process on step 3, 4, and so forth. So you don't have to spell out that once step 2 is complete, then go to step 3. Once step 3 is complete, you have to kind of write this in a way that allows the reader and you and anybody else who looks at this to understand that, okay, so we're doing this forward chaining. We teach a step first, complete the rest for the individual. Once step 1's mastered, we go to step 2 and so forth. Okay, hopefully I'm not moving too quickly here. I'm just trying to give you some things to think about for the next protocol. Okay, let me call up another one. Okay, here's another example. Purpose looks great here. Purpose of the protocol is to increase independent teeth brushing. So again, this student is saying we're increasing independent teeth brushing. I added forward chaining and a task analysis. The master criteria looks good. So the target behavior is good. Again, correct response is not wrong. Sorry to sound like a broken record, but in retrospect, I think saying independent response would have been better, and then maybe fill out this definition a little more. So, but nevertheless, this is good as it is. The learner will independently complete each step as described on the task analysis. So the target behavior, and I realize it's unlike any other target behaviors we've probably talked about in the past, but it's sort of, I'm making this term up. It's not a technical term, but it's a flexible definition or a conditional definition that depending or conditional on the step in the task analysis, the reader should know what's correct versus incorrect. Okay. There's a baseline in here. That's fine. So this was a nice, clean format, and I think pretty clear steps. So let me just go through this. Forward chaining. Each trial will begin by the therapist delivering the SD, brush teeth. The therapist will instruct step 1 of the task analysis. The therapist will physically guide the participant through the rest of the steps on the task analysis. So it's indicating that there's some instruction going on in step 1. Now, of course, the instructions come down here, but there weren't a lot of instructions in this, so we need to know what those instructions are. For example, is it prompting or some other method? Okay, not too much else I want to indicate on the data sheet. Task analysis is down here. That's another thing I saw. A few of you sort of either didn't include a task analysis or it seemed to be embedded in the procedures for doing the forward chaining. Typically, a task analysis is separate. It has its own section or maybe even its own document. Or it's combined with the data sheet. Right, so this individual, another thing I thought was great about this is the data sheet, right? But yeah, typically we could kind of really define all the steps of the task analysis on the data sheet and just simply have, independent versus prompted or correct versus incorrect, whatever you choose. So this data sheet looked fantastic. Okay, let me select another example. Okay, here's another one. Once again, I made the comment about the correct versus independent, but a good definition nevertheless. So independently completing the targeted step on the task analysis. And then the prompted responses, that's important. So if we're using prompting, we have to indicate how prompting is conducted. So therapist provides a verbal instruction to complete the step. Gesture, therapist points or gestures. Physical, therapist provides hand over hand assistance. And I think I missed this when I graded this paper, but hand over hand includes hyphens. You have to excuse me, I have terrible allergies today. So what else? Task analysis looked great here. I think the procedures here were very well written. So therapists will use the task analysis. I think that's an important step, and begin by teaching step 1 with the instruction, brush your teeth. Then they have the contingencies for correct versus incorrect or whatever you targeted. And then after step 1 is complete, the therapist will assist the client in completing the remainder of the task analysis. That's what happens. We have to get the task done, right? So we help them, right? We think of it this way. For step 1, we give them an opportunity to do it independently. If they can't, we teach them, and then we prompt them or guide them through the rest of the task. Once they get step 1, then we give them an opportunity to complete step 2 independently. If they can't, we teach it, then we complete the rest for them. So it's a sequence in that direction. So they say after step 1 is completed, the therapist will assist the client in completing the remainder of the task analysis. The next session begins at the next time. She has a mastery criterion in here. And then the process will continue. So this is better. There are some things missing in the sequence of teaching, but nevertheless, a decent protocol. Okay, here's another example. I thought the target behavior looked good, but once again, here's where where you had some difficulty keeping correspondence. So you have correct response, but the data collection is independent versus prompted. So the data collection needs to measure the target behavior. So it needs to be correct versus incorrect. Task analysis looked fine. There's a missing step there. These were just some formatting errors. If ever we use a acronym or an initial to indicate something, like in this case, the prompting level, you always write the word first, physical, and then the initial if you want to do that. So, and actually the initial is typically in parentheses. So keep that in mind. I'm not sure what a faded physical is. I guess you're indicating faded prompts. Typically that would be called a partial physical prompt. The other thing about this particular protocol is you have a lot of prompts in here, which I guess is not wrong, but I think it would be confusing for people to follow. Because when we think of prompting, we think of the basics of physical prompting, gesture, verbal, or a comprehensive approach like most to least prompting or least to most prompting, prompt fading, all of those things. So, and modeling is something in and of itself. Obviously, a model can serve as a prompt, but I think you have too many things in here. So I would simplify it. And independent is not a teaching strategy, right? So you have this section as teaching strategies, prompting methods. This isn't either. It's basically what happens if none of the prompts are required. What else is here? So you have prompts. I think that's okay, but I think you might want to be more specific that you'll use this prompt first, then this prompt, and then the next prompt. The error correction, again, I think you're adding too much in here. Let's not complicate things at the outset. Let's start simple. If we needed an error correction, we can include that. But once again, when I think of something like teaching a task analysis to brush your teeth, I'm more interested that they're acquiring the steps independently, or rather they acquire the steps and perform them independently, rather than getting it incorrect and then correcting it. So I'm just going to teach. If I see something occurring that shouldn't, like if the step is turn on the water and they turn on the hot water, I'm just simply going to teach how to turn on the cold water, right? And make sure they get it without prompting. So keep that in mind. I'm going to point out 2 more examples and that will be it. So, again, a lot of these contain the same type of issues. Okay, so for the task analysis, the student has ensure all teeth, all sides have been brushed. That's not really part of the task. I mean, you need to think of the task analysis kind of from the participant's view. Brush the top set of teeth or the left and then brush the right. So that was that. Then, this says forward chaining, but it's not describing forward chaining at all. And there are a couple other problems here. But while I'm thinking of it, a lot of you still make this mistake. You're including words like would. So, for example, the participant would begin or the participant should begin. Be active and direct. The participant will do this. A few of you even wrote in the past tense. Again, when we're writing protocols, they should be in the active tense, that the therapist will do this. Okay, so let's just take this apart here. The participant will begin with the first step with the forward chaining procedure. They will independently pick up the toothbrush, this being one of the simplest steps, and would use this as momentum for being able to complete the rest of the steps that follow. So this sentence doesn't really describe anything about forward chaining. And it makes some assumptions. Once again, this is something we don't do in behavior analysis. You also have here they. We need to know who. Do you mean the therapist or do you mean the participant or the client? We're not sure. Is picking up the toothbrush a simplest step? Again, as a scientist or as a behavior analyst, we can't make assumptions like that. And then that it's going to be momentum to complete the rest of the steps. That, again, is scientifically an incorrect statement. We can't say stuff like that. And it doesn't really make sense that just because you do one step, there would be momentum to complete the rest. So this protocol didn't really have too much in the way of teaching. So I'm not sure how we're actually teaching the tasks here. Okay, last example here. I don't want to spend a lot of time on this. The main thing about this one is that the teaching is not clear. So you have that each step in the chain. It's okay to reference it. Well, no, it's not. In this case, if you're referencing a behavior within the task analysis, yes, it is a behavior chain, but you need to reference the task analysis. Each step in the task analysis will be completed. The therapist will explain to Joe to squeeze the toothpaste on the toothbrush. If Joe has a difficult time emitting the response, the therapist will demonstrate the task. So I understand you have demonstration in here, but that is not a behavior analytic procedure. How are we teaching, right? Are you prompting it? This would be a model. And then what happens? Do you allow the person to try to do it? What happens if they don't imitate, or what happens if they do something else? We need to make sure that all of that is laid out for the person following this. The therapist will display the motion to brush teeth. So again, this is a gesture. At this point in the program, you should really be using the terminology. Joe will be instructed. How will he be instructed? Even more so, I'm just adding sort of constructive critiques here. You have, he will be instructed to sing happy birthday in his head 2 times. How will, if that's important, how will we know that he has done so? Right? I don't know. My daughter has done this with the hand washing. They sing happy birthday and eventually becomes covert. I don't know if she's doing it or not. So, think of these things as you're developing a protocol, particularly for an individual with developmental disabilities, right? I would probably use a timer if time is important. And incidentally, time brushing teeth is important. I think only a couple of you had the duration of time the person should actually be brushing, and that tends to be important. Okay, so this one, again, I don't want to belabor the point. It just was not clear on how we are teaching the procedures. Okay. Data sheet was okay. Again, for data sheets and the task analysis, I like to include the task analysis steps. And then we're recording whether or not they were completed independently versus prompted. Okay, so that is it. Hopefully you find these little videos instructive. They are meant for all of you. So I will kind of add this little statement in here to see how many of you actually are sitting through these. So if you got feedback on your paper and got a score lower than desired, you could edit the paper and hand it in, and I will give additional credit. It may not be full credit, but I will give additional credit. If you got all 10 points, there are revisions to be made. If you make those revisions and resubmit, I will add a little extra credit point on there. So sort of a check to see how many people actually watch this video. Okay, have a good weekend.